Hi, my name is Ashley Nelson, and today I'm going to talk to you about myasthenia gravis, not just a diagnosis. Myasthenia gravis is an autoimmune disease that is characterized by weakness and fatigability. In order to understand the implications of myasthenia gravis, it is important to consider the pathophysiology, symptoms, tests, diagnosis, and treatment. For many in healthcare, it's just another diagnosis. It is not until a diagnosis affects a family member that it really hits home. I'm going to share information with you regarding myasthenia gravis, as well as a bit about my grandfather's battle with this disease. Let's start with the pathophysiology. In order for skeletal muscles to contract effectively, acetylcholine must attach to acetylcholine receptors at the neuromuscular junction. This initiates an action potential, which proceeds to muscle contraction. In myasthenia gravis, antibodies attach to acetylcholine receptors, preventing the acetylcholine from binding. This in turn creates muscle weakness and impaired contraction. Another component to mention is that in most cases, pathological changes occur in the thymus. The thymus regulates T cell reactivity. With thymomas and hyperplasia of the thymus, there is an immune-mediated attack of antibodies on acetylcholine receptors. Apart from this paraneoplastic mechanism, no cause for myasthenia gravis has been found. It has been speculated that a possible viral hit could initiate the antibody production. However, this has not been proven in research. Now let's talk about some symptoms of myasthenia gravis, the most common being weakness and fatigability. Myasthenia gravis affects skeletal, ocular, facial, and bulbar muscles. Other symptoms can be double vision, difficulty with speech, difficulty swallowing, unsteady gait, and weakness of neck muscles. People with myasthenia gravis go through periods of remission and crisis. Myasthenia gravis crisis can be triggered by infection, stress, as well as certain medications. Along with symptom analysis, tests can be done to confirm the diagnosis of myasthenia gravis. 3 tests can be used to confirm. First, the tensilin test. Tensilin decreases the amount of cholinesterase at the neuromuscular junction, which makes acetylcholine available to muscles. For this test, the patient is given 2 doses of tensilin. If the patient has myasthenia gravis, following the second dose, they will have an increased strength that lasts about 8 to 10 minutes. The second test is lab analysis of acetylcholine receptor antibodies. These antibodies are present in 80 to 90% of patients with myasthenia gravis. Finally, electromyography involves repetitive electrical stimulation of the muscle. In myasthenia gravis, the muscle response weakens after 3 shocks. This test assists in the diagnosis of myasthenia gravis in 99% of patients. Treatment of myasthenia gravis includes acetylcholine esterase drugs, immunosuppressive drugs, plasmapheresis, administration of immunoglobulin, and thymectomy. The anticholinesterase drugs assist in preventing the breakdown of acetylcholine and acetylcholine esterase, as well as improving the transmission of impulses across the neuromuscular junction. Immunosuppressive medications decrease the body's attack on acetylcholine receptor sites. Plasmapheresis involves removing acetylcholine receptor antibodies from the patient's plasma. Lastly, the option of thymectomy is another mode of treatment which assists in reducing symptoms. Now I'd like to introduce you to my grandpa, Gary. He is 77 years old and was diagnosed with myasthenia gravis about 2 years ago. Prior to his diagnosis, my grandpa was an active, energetic guy. You could often find him fishing, mowing the lawn, and working on many projects in his workshop. It is unclear what triggered my grandpa's decline and eventual diagnosis of myasthenia gravis. Increasing weakness started to plague his body, and getting up to get a glass of milk was tiresome. He went from running circles around his grandkids to requiring help with many activities of daily living. His arms cannot reach higher than his shoulders. This makes it difficult to get a shirt on or a jacket. Another symptom that he struggles with is the inability to swallow effectively, as well as fatigue when trying to chew dense foods. Not only has it impaired his ability to be completely independent, but it has also taken away joys that he used to partake in. He requires frequent rest between activities and is often frustrated by his inability to complete a task on his own. From a granddaughter's standpoint, watching him go through this has been heart-wrenching. My grandpa did amazing work with his hands and tools. He was strong, and now he is weak and must ask for assistance with certain things. My grandpa has good days and not so good days, but his good days outweigh the tough ones. So many times when we are learning about a diagnosis, it's just a diagnosis. Myasthenia gravis was that way for me until it hit home with my grandfather's diagnosis. We as healthcare professionals need to challenge ourselves to empathize with our patients and their diagnosis, always keeping in the forefront of our minds that the work that we do affects people's lives. It should never be the patient in room 1903 with myasthenia gravis. That patient has a name, a face, and a story to share. Remembering to treat the person and not the diagnosis is the answer. After all, while myasthenia gravis is the diagnosis, Gary is his name, he is my grandpa, and he makes me proud. Thank you for listening.